Hello folks, welcome to Legacy IAS. In today's video, we will be discussing a current affair topic. This is presented to you by your faculty Sushma KP. So what is the topic that we will be discussing today? It is idiopathic pulmonary fibrosis. Now in this topic, we will be discussing as to why is it in news, what is the relevance to you in your UPSC, it is directly your prelims. What is idiopathic pulmonary fibrosis? What are the causes to it? What are the risk factors associated with your IDF? We will also be seeing some prelims questions based on this. First of all, why is it in news? India's very own tabla maestro Zakir Hussain died because of this disease. Look at this, Zakir Hussain, India's famous tabla maestro, died due to this dangerous disease. What is this dangerous disease? This dangerous disease is your idiopathic pulmonary fibrosis. What is idiopathic pulmonary fibrosis? Simpler terms, your air sacs, which is very much necessary for your breathing, are scarred and fibrous, which means they are damaged. Progressive damage keeps happening. This is your idiopathic pulmonary fibrosis. Let's have a look at this portion is your healthy functioning of a lung. This portion is the functioning of a lung for someone who is affected by your IDF or idiopathic pulmonary fibrosis. Look at this. This is the bronchioles, this one. Whereas this globes, these are your alveolus or your alveoli. Your alveoli is the last part or end part of your respiration or respiratory. This is responsible for exchange of your oxygen and carbon dioxide. So when the air sacs get damaged, which means they are not completely capable like the normal lung for transporting or exchange of gases. Which gases? Oxygen and carbon dioxide. Look at this with respect to lung affected by idiopathic pulmonary fibrosis. The bronchi is very dilated, and also look at the alveoli. Look at the shaping here and look at the shaping here. And also fibrosis. Fibrosis means what? Scarring of tissue. In this case, lung tissue. See, can you see this pattern? This hair-like patterns, nothing but scarring. And this scarring increases or progresses over time. What are the alveoli? The alveoli in the lung. Look at this tiny small dots that you can see. When expanded, this is the. Now, what is this alveoli? These become thick and stiff, which does not let it for easy transportation of oxygen into the body. What are the causes of your IDF or idiopathic pulmonary fibrosis? First and foremost, fibrosis means scarring. Idiopathic means the cause is not known. The cause is not known, or we don't know what is causing it. That is the reason it is called as idiopathic, which means we don't know what is causing it. But there are some associated risk factors that this might accentuate, or this is what is one of the main risk factors leading to. So, what are those risk factors? First and foremost, smoking. When it comes to smoking, largely it affects males over females. What age group it affects? The age group it affects is from 50 to 70 years of age. Second thing, the risk factor, or it could also be genetic in nature. Next, your issues such as, it could be either any viral infections. We are not telling this is the reason it is causing it, this is one of the risk factors. And then another thing is with respect to acid reflux. Now in recent years, initially it was very much prevalent over males. Nowadays the cases in females is also increasing. We said the air sac in your IDF, the air sac becomes thick and stiff. Look at the air sacs of the normal functioning lung and look at the air sacs of your lung affected with IDF. See, look at the difference here. This is the air sac wall, just this much to be more specific. Whereas when with the lung affected with IDF, look at the air sac thickness. This is what we mean, the air sac is thick and stiff, which reduces, look at the spacing here and look at the spacing here, which reduces the oxygen. Can you see the oxygen and carbon dioxide? Can you see here? Can you see how less space is left there for oxygen? What is the diagnosis? First and foremost, with respect to India, the diagnosis happens in a very later stage. One of the ways of diagnosis is through your chest x-rays, and also when they come to know about the diagnosis in India compared to the western countries, it is very late and advanced. And also according to the doctors, once the person is diagnosed with your IDF, they do not cross stage 3 and stage 4. Within that, death happens. What are the symptoms? Common symptoms are, one of the main reasons why they are not able to diagnose it in early period itself is because its symptoms are somewhat very close to how your asthma is. They have difficulty in breathing, fatigue, tiredness, and also dry cough alongside your clubbing of fingers. So with these symptoms, it becomes very difficult to identify. The diagnosis, usually it is through your chest x-ray. What are the treatment, or is there any cure? Is there any cure present? The answer is, for treating idiopathic pulmonary fibrosis, there is no cure yet. The only thing we have been known to be using, at least in certain western countries, is by using antifibrotic agents and also performing oxygen therapy. But these are not permanent solutions just so that they can increase the lifespan by 1 or 2 years. There is no permanent cure. Zakir Hussain was suffering from this and he was trying to take treatment in US. Now we will look at possible prelims question, and through that we will learn few things. With reference to idiopathic pulmonary fibrosis, consider the following statements. IPF is a chronic lung disease characterized by the progressive scarring of lung tissue. Like we mentioned, it keeps on increasing, the scarring keeps on increasing in the lung tissue. This option correct. The exact cause of IPF is known. We just said that. It is unknown. That is why the name idiopathic, which means the cause is unknown. This eliminates the option. If you eliminate 2 from the option, your C and D is eliminated, and yet it is left with A and B, 1 and 3 only, 1, 3, 4 only. So, what is the third option? Smoking is a risk factor for IPF. Correct, we discussed it. Next, pirfenidone is a medication used to treat IPF. Answer is correct. Yes, pirfenidone is used as a medication to treat IPF, but again understand it is not used to cure the disease. If any medication we are trying to use for IPF, it is only to increase the span, that is reduce the scarring, or supplying through your oxygen therapy. You do not cure the disease, till there is no cure. So, the option is 1, 3 and 4, that is option B. Next, which of the following is a characteristic feature of idiopathic pulmonary fibrosis? Rapid progression of symptoms, reversible lung damage, progressive scarring of lung tissue, acute inflammation of the lungs. Rapid progression of symptoms. The symptoms you are not able to distinguish between your common asthma and your IPF initially. So, which is why there is delay in the diagnosis because of the symptoms. So, this is not the answer. Reversible lung damage. No, it cannot be reversed. There is no cure for it. Acute inflammation of the lungs. More than acute inflammation of the lungs, lung tissues, moreover your alveoli. So, the correct option here is progressive scarring of lung tissues. Option C is the answer. Next question. Which one of the following is known risk factor of idiopathic pulmonary fibrosis? Smoking, diabetes, hypertension, all of the above. We have discussed one of the main risk factors is smoking. That's it, we have reached the end of the content. If you do like our content, subscribe to our channel, hit the like button and share it along with your friends. Thank you.